Thank you very much. First of all, we commiserate with the family of Nanyah for the death of the singer. It's highly unfortunate. We commiserate with the artist and all his family, and also commiserate with Nigeria. It's a painful thing. It's not a good thing to be mourning somebody, and especially from the healthcare the person is supposed to receive. And also, I have to make also before I move, I've interacted with the FMC Abuja, and what I was told was that the patient was given anti-snake venom, just to clear that one, and they also brought their own reports to the public. Let's now go to the main issue. I always said, I will continue to say it. You look at the federal government, the state government, and local government are not listening. And the main thing is that the primary health care is the most important thing in health sector, in healthcare delivery system. The primary health care should take about 60 to 70% of the budgetary allocation, now followed by the secondary, and now followed by the tertiary. Unfortunately, in this country, government face more secondary and tertiary and neglect the primary health care, which is the basic of care in any country of the world. Any country that is no primary health care, it has a failed health system. We are having a failed health system in this country. That is the truth. Because in Lagos State now, we have about 300 primary care centers. With the population of Lagos, that primary care center cannot cover the whole Lagos. And from this 300 primary care center, how many of them have doctors? Those are the questions we must also ask. Now, pertaining to the primary health care, the government should look into the primary health care. All these antiviral, anti-snake, anti-drug rabies, all those simple basic things should be available. And what do you mean primary health care? Primary health care means the first place you go for health care, and should not be a distance from your house or from your job, from everywhere you work. And what do you mean is that in each ward, even within the ward, I'm talking about ward in terms of local government, in each ward, you should have at least one primary health care center. Do we have that? And two, I've told government again that primary health care is not only by the government. They should also collaborate with the private sector in medical care, in the sense that the private hospitals or clinics around the primary health care should also be giving what we call primary health care, very simple, with lesser amount of money that the people will pay. That if you have your BP, you can go to any other place, you can take your BP. You can, by the time the incident happens, the first place they should go is the hospital nearer. We can be a primary care. We can be, if I say a primary care should not be far, in the sense that at this anti-snake or venom to be given.